Hello, I'm Todd Didier, Communications Director for the Primary Care Collaborative. Every month, the PCC recognizes outstanding leaders from across the healthcare landscape who are working to improve our nation's health by strengthening primary care. Today, I'm thrilled to be joined by our latest champion, Shari Erickson, Chief Advocacy Officer and Senior Vice President of Governmental Affairs and Public Policy for the American College of Physicians. We're also thrilled to have Shari as the co-chair of both our Policy and Advocacy Committee and our Better Health Now Committee here at the PCC. Shari, thank you so much for joining us.
Thank you for having me, Todd.
So, just kind of jumping straight into it, learning a little bit more about your background, how did you become a primary care champion and why are you so passionate about strengthening high quality whole person primary care?
I would say it goes all the way back to early in my career when I was working for the Institute of Medicine, now called the National Academy of Science, Engineering, and Medicine. When I worked there, I had the opportunity to investigate a lot of different issues, including the importance of primary care, the importance of patient safety, of high quality health care. And it became very clear to me early on that the data show that high quality primary care is really the foundation of our healthcare system. So that led me into working at the National Quality Forum, where I did work on a variety of issues as well related to improving the quality of healthcare in this country. Ultimately, I am now at the American College of Physicians, where I've been for about 18 years working on these issues. I'm very passionate about it. In fact, when I had my children, the first thing I did when I went to go talk to interview pediatricians was to ask them about whether or not they had heard of a patient-centered medical home and were they using electronic health records and how were they communicating with their patients on a regular basis.
No, I think that's right. The relationship part I think is particularly important, but kind of touching on that, why do you think it's so important we start with primary care to address our broader healthcare concerns?
The data are really clear that having primary care access improves the health outcomes of patients across the country. It improves their experience with the healthcare system and also reduces cost. So it's a critical underpinning of the entire healthcare system and something that uh, is needed in order to address the bigger problems, the other problems, I should say, that we have in the healthcare system. Without the strong primary care base, it's nearly impossible to try to fix everything else going on.
Absolutely makes sense. Primary care, obviously foundational to our health system, but as we know, the primary community faces challenges today. Could you let us know what do you see as the most pressing challenges in primary care, and how can both clinicians, but other type of partners, including other PCC members, other stakeholders, help address these challenges?
One is that we have a challenge with the pipeline coming into primary care. That is exacerbated today by some of the issues going on through the federal government with regard to some visa related issues for those that are international medical graduates who often come to this country and are able to provide care to many rural and underserved communities in this country, in providing primary care, I mean, in particular. And so that's one aspect of that challenge that's been exacerbated today. And also, though, I think that there's a challenge in terms of the payment that primary care receives. It is certainly not not enough, and also doesn't reflect the very difficult and complex work that primary care clinicians do, providing care to their patient populations. And so that is a critical issue that needs to be addressed that I think also impacts the pipeline of individuals coming into primary care. And then and administrative burden is another piece. There's so many burdens that are placed squarely in primary care's lap, so to speak, to help address issues related to quality, to patient safety to public health, and so much of that falls to primary care today. And so it can be overwhelming for individuals going through medical school, going into residency, to think about taking on those challenges in an environment where they are not paid appropriately to handle those issues. So, it's a multifactorial issue, I would say, or set of issues that having a coalition like the PCC can really help with that, because we do have the payers around the table. We do have patient groups around the table, employers, everybody who really plays a critical role in the healthcare system overall, and in particularly helping to support, finance, um, engage with primary care clinicians, whether physicians or other clinicians as well, and even the staff within those primary care offices, who are critically important to ensuring that the physician and the other clinicians are able to do their jobs.
Yes, definitely a lot of work to do. And luckily, we have some phenomenal leaders in the primary care space, but they definitely need some support. And I think one area that you would agree they could use some support in is in the policy arena. Kind of thinking about that, your major role at ACP. If there was one message that you could deliver to policymakers about the importance of primary care, about what we need to be doing to support it better, what would it be?
One key issue that I haven't even addressed yet is access to healthcare coverage, and the critically important role that plays in patients across the country being able to access primary care consistently and build those relationships with their primary care clinicians. And we do have a crisis in access right now, given the cuts that have gone into effect for Medicaid. And that particularly affects children and many underserved individuals across the country. And so that is something that we need policymakers to step up and address. In addition, the expiring tax credits for those that are on the Affordable Care Act exchanges, those going away is going to critically impact people's ability to access care overall, and in particular primary care, because if their premiums go up significantly, then they are not going to be able to afford that coverage, and then and have access to primary care. So that is a critical message we need to get across to policymakers right now. Beyond that, I will say that I think the other issues that we talked about already with regard to Medicare payment, and improving that, and which also influences the payment of other payers, private payers as well. Um, that is something else that we need to continue to address, because there's such a disparity between the payment that goes to primary care clinicians in this country relative to other specialties. And it just certainly does not reflect the complex, comprehensive care that primary care clinicians provide every single day to their patient populations. Changes to the H-1B visa, adding a fee for that, as well as some of the um, limitations that are being put on J-1 visa holders. Again, certainly for internal medicine, our most recent match for internal medicine, a third of those individuals coming into to do their residency are foreign-born international medical graduates. That's a third, and they of internal medicine, certainly, and they provide care to those in rural and underserved areas. The data are clear on that, and so I think that is another worry I have, that I really would like policymakers to prioritize and address in the short term, so that we don't have, this sort of pipeline that's already a bit stifled due to payment issues, administrative burden issues, all of that, now being stifled even more because of limitations of the ability for foreign-born medical graduates to be able to come here and practice.
Obviously, federal policymakers need to make efforts to make sure that we are addressing the access issues caused by the changes to Medicaid, the APTC issue that you mentioned, rising costs in general. But one area where, especially as federal policymakers are debating to address these issues, one area where there may be some space for additional support is at the state policy level. Are there any messages you might have for state policymakers, state leaders about how they can work to strengthen primary care and what efforts they should be taking?
For states, I think one solid example is from Rhode Island, where they worked with the insurance commissioner there to ensure higher percentage investment in primary care through the insurers in that state. Right now, across the board, only about 4 or 5% of healthcare dollars go into primary care. And given how important it is and the fact that we know through the data that it is really the type of care that improves patient outcomes, reduces cost, um, it, it's it's critical that we have greater investment. And so I would say that one thing state policymakers can do is to work with their insurance commissioners, within their state to see if they can move forward a policy like that. The other thing I would say is there are a number of related issues going on now that are have been around for a little while, but seem to have had an uptick. And one example of that is downcoding. So some insurers today have implemented processes that automatically downcode some level four, so to speak, or more complex visits with the patient to level three visits. And then obviously that impacts payment overall and is not based on evidence, to be honest. And so I do think that that is something, all politics are local and all healthcare is local. So, and in this case, insurers operate very differently in different states and have different policies and different mix of payers, all of those things. And so I think that is something state policymakers can work to, again, sort of getting at this important of investment in primary care. That's just the opposite by doing, this sort of downcoding initiative. Um, and the other thing I would say too is working with their insurance commissioners and their local payers on things related to prior authorization. Another, that's a significant administrative burden that a lot of primary care physicians have to deal with on a minute to minute basis practically. And there are mechanisms to improve those processes, and so we need to have those implemented. I certainly understand that there are times when there may need to be a double check on some sort of expensive service being provided, but I mean, again, the data show that this complex care that primary care physicians are and other clinicians are providing to their patient population not only improves quality but reduces costs. So having those, having prior authorizations or automatic downcoding happening, things like that. Those are the types of things that state policymakers really can work with their and should work with their local insurance commissioners about. I would say the other thing is, again, getting back to Medicaid coverage, and obviously there's somewhat limited things that they can do because of the uh, the bill that has resulted in a lot of significant cuts to Medicaid across the country. But states may have to get a little creative in terms of how they're able to finance Medicaid to provide coverage to the same number of people they're able to provide coverage to now. And so hopefully, we can identify some of those policy solutions and work with policymakers in the states to implement those so that we can try to reduce the losses of coverage for patients in across the country in those states.
I think those are some real pragmatic, thoughtful approaches to how states can kind of help address a lot of the challenges that we're facing. We've had, a pretty wide-ranging discussion here today, a lot of thoughts and some real nitty-gritty policy ideas. So I always like to take this a step back and think about this with our rosiest glasses. If, and just as kind of an ending question here, if you could wave a magic wand and change one thing in the American healthcare system overnight, what would it be?
Universal access to health insurance coverage in whatever mechanism that can be done. I do think that the ACA has been able to increase access to coverage in across the country, but unfortunately, given some more recent changes, including the Medicaid cuts as well as the expiring tax credits, we're going to be seeing people sort of losses in that access to healthcare coverage. But it's like primary care, it's really another underpinning of our healthcare system. And there are so many individuals out there who are uninsured or underinsured still, and we'll have more of those, over the next several years, given some of the more recent policy changes that we need to think through how to do this, and how to get that universal coverage in place. So in my ideal world, everybody would have access to health insurance in this country, and then they would therefore have much more ready access to primary care clinicians.
Well, Sherry, I think it's hard to argue with that. Thank you again so much for joining us, and congratulations on being named a primary care champion. Thank you for all the phenomenal work that you and ACP are doing on behalf of Americans to improve our nation's health. And we're so grateful to have you as a member and so grateful for the phenomenal work you're doing at ACP.
Thank you for having me, Todd. I appreciate it.